Sahani sir.
Thank you, sir.
Good evening, good afternoon, and good morning. This is the 1348th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. MEHTA from Delhi. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have doctors from different part of the world participating in the session. Already, doctors from 65 countries presented papers on different subjects, and all the papers were extremely brilliant one. And as you all know that there are 3 sessions in a row. The first session is already over by 8 p.m. Today. That was our Hindi session. 8 to 9, we have our international session in English. And 9 to 10, we have our local language session in Malayalam. Let me introduce today's guest, Dr. MEHTA. She has completed her BHMS and then PG Homeo in London. From London, she has completed certificate courses in oncology and currently posted as palliative care physician at Rajiv Gandhi Cancer Hospital, New Delhi. And she has specialized in many areas in holistic medicine, mind, body, soul, integrative oncology, pain and palliative oncology, supportive care oncology, reducing side effect of conventional cancer, treatment, nausea, vomiting, etc. Benign tumors and growth, allergic and inflammatory diseases, skin diseases, neurological disorders, endometriosis, so many. And at present, palliative care physician at Rajiv Gandhi Cancer Hospital and Research, and she's a faculty at the London College of Homeopathy, United Kingdom, July 29 onwards. And she is a wellness consultant. She has worked as a wellness consultant at Star Wellness Center, Tilak Nagar, New Delhi, and she is a homeopathy consultant, Bhagavan Mahavir Hospital, New Delhi, homeopathy consultant, Vardhan Jain Hospital, Rohini, New Delhi, and Cure Well Cancer Care Center, Roshni, New Delhi, and so many places she had worked in with homeopathy for practicing or solving the cases of patients. She has also worked in Baxton Allergy Center, Greater Noida. These are all about. She is a winner of many awards. Hahnemanian Award 2010, awarded by Delhi Homeopathy Board for rendering the best service. She has won another award, Zulfi Award of Distinguished Services of Homeopathy in 2014, Appreciation Award 2016 from Board of Homeopathy System of Medicine, Delhi, Homeo Icon Award 2019 by Delhi Federation, and Distinguished Service Award by Heart Care Foundation of India for giving OPD service at MTML Perfect Health Mela 2019. And she has presented so many papers in different part of the She has membership in International Homeopathic Medical Society, Liga Medical Homeopathic, International Healthcare Foundation of India, etc. And today, Dr. MEHTA will be presenting homeopathic approach to heart and arterial diseases. This is a very good area where homeopathic doctors can establish themselves as perfect cardiologists. So let us proudly welcome our beloved guest, Dr. MEHTA, to this session. Welcome, madam.
Thank you, everyone. Thank you very much for having me for this discussion. Definitely, homeopathy has a very good scope in treating the diseases of heart and arteries. And I have worked with a very renowned allopathic doctor who used to consider all the alternative therapies also. He was Dr. K.K. Agarwal, who got very famous during the COVID time, who was telling everybody what to do, what not to do. And he unfortunately passed away during the COVID due to the effect of the second dose of COVID vaccine. So let us discuss the disease of heart and arteries. There are three main divisions into which organic affections of heart and vessels may be classified. Number one, acute inflammatory diseases. Number two, chronic consequences of acute inflammations which lead to heart diseases. And number three, affections which are chronic from the beginning, like some heart defect by birth. And last but not the least, the effects of sudden heart strain or sudden emotions, effect of prolonged muscular overexertion, as in athletes, faulty dresses, like in West, some people used to wear wired dresses, ladies used to wear tight wired corsets, drugging, including the effects of alcohol, tobacco, chronic kidney disease, bad habits, residencies at higher altitudes, like people living in Ladakh, and surgical interference with constitutional diseases. So there are so many causes which can lead to the disease of arteries and heart. Of course, we cannot forget that the diseases of heart are also, they are also caused by rheumatic fever, which is the most common cause. Whooping cough and specific fevers like scarlatina, measles, typhoid, typhus, diphtheria, coming next in frequency. And it must not be forgotten that the heart may become the seat of inflammation primarily from a chill, independently of any other disease, just as there may be inflammation of lungs or any other organ from the same cause, chill. You know how the serous membrane which covers the heart, that is pericardium, and that which lines inside is endocardium, are peculiarly liable to become inflamed when the blood is charged with the irritating poisons. These poisons could be the poison secreted by the infection present in the throat, by the bacteria or by the typhoid bacteria, or uh, due to any drugs like chemo drugs. People take chemo drugs during the cancer treatments, they can also inflame, or any other drug, harsh drug treatments they're taking due to some other diseases. They can irritate the lining of the heart inside the endocardium. These inflammations are capable of subsiding without leaving behind any discoverable trace of their, occurrence, but sometimes they make permanent changes. Some people say, I have been dragging my leg. It is altogether inflamed since I suffered that fever. I cannot walk faster since I recovered from that kind of disease. I am not well when since I suffered from that measles and mumps. So what happens? These irritating poisons, they inflame the inside uh, part of the endocardium of the heart, and what happens when there is an inflammation? It becomes narrow, and the walls also become inflamed, and they don't open and close properly. So whenever the person is walking or doing some exertion, like people will they don't get to know, but they will tell you initial, when we used to go to the marriage parties and functions, we could dance for hours together. But now if I have to just dance with my hands up, I just literally gasp for breathing. And I have done all the tests and everything is fine, my ECG is fine, but I am not the same person the way I was. So homeopathic medicines are having the capability to restore these dysfunctions, to restore these inflammations. How? Because if you read a lot of literature written by the homeopaths, they will tell you that when they started treating homeopathic cardio cases with homeopathic remedies, so we are not that much brilliant with the stethoscope. They were very, very much, they were very much perfect with their tool, their stethoscope. Just by hearing the heart sound, they could make out that the valve is not right, or some part of the heart is not functioning properly. And they used to treat that person, and the person used to live longer. When he used to die, they used to do autopsies, and they got to know that these person lived longer with homeopathic medicines with a faulty valve and some other conditions. So let us try to understand a little bit what I know. This is the blood circulation diagram. Look, this is the whole circulatory system. The left side of the heart, it is taking the oxygenated blood to the tissues, and then the deoxygenated blood is taken to the lungs. First from the liver, and through the portal circulation, it is going to the right side, and from the right side, it is going to the lungs. So in this, or in these pathways, wherever there is any congestion or inflammation or any toxic waste products start coming out or obstructing the way, the circulation is disturbed, and heart has to work harder to maintain the circulation. When people starts suffering from irregular heart rhythms or hypertension. Key facts. Cardiovascular diseases are the leading cause of death globally. An estimated 17.9 million people died from cardiovascular disease in 2019, representing 32% of all global deaths. Of these deaths, 85% due to heart attack and stroke, not cancer. Over 3/4 of cardiovascular deaths take place in low and middle income countries. Out of the 17 million premature deaths under the age of 70 due to non-communicable disease in 2019, 38% were caused by cardiovascular disease. Most cardiovascular diseases can be prevented by addressing behavioral risks such as tobacco use, unhealthy diet, obesity, physical inactivity, and harmful use of alcohol. It is important to detect cardiovascular disease as early as possible. And we homeopaths can see a cardiovascular disease coming by studying the whole symptom totality of the patient. What are the cardiovascular diseases? Coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart diseases, deep vein thrombosis, and pulmonary embolism. Coronary heart disease of blood vessels supplying the heart muscles. Sometimes there is narrowing in smokers of these blood vessels, and they suffer angina-like pain and little heart attacks, which even they don't bother and keep on smoking. Cerebrovascular disease is of blood vessels supplying the brain. People start getting feeling this cervical pain, and they ignore it like a cervical pain or pain at the back of the neck, and very regular migraines and headaches. Peripheral artery disease of blood vessels supplying the arms and legs. You will see they will say, "Doctor, I have swelling in my one side. This arm is swelled. Sometimes the leg is swelled." And then it goes off. When I massage or when I take some medicine, on and off, it starts to come on and off. Rheumatic heart disease, damage of the heart muscle and heart walls from rheumatic fever caused by streptococcal bacteria. Congenital heart disease, birth defects, VSD, ASD, where there is which affects the normal development and functioning of heart caused by malformation of heart structure and birth. Deep vein thrombosis and pulmonary embolism, sometimes they occur after liver infections also, because liver produce proteins which are responsible for the clotting of the blood, and clotting factors it produces. So when it is not working properly, the quality of blood becomes thick, and there could be deep vein thrombosis and leading to pulmonary embolism. There are blocks. The blood gets thick and it blocks the pulmonary artery, it blocks the lungs and causes all the problems. Heart attacks and strokes are usually acute events and are mainly caused by blockage that prevents blood from flowing to the heart or brain, like from cholesterol. The most common reason for this is a buildup of fatty deposit on inner walls of blood vessels that supply the heart or brain. Strokes can be caused by bleeding from blood vessel in the brain or from blood clots. Now to To be able to find out the right homeopathic remedy, we must be sure for the common symptoms of the disease. What are the common symptoms of the disease? Because our medicine will sit on the particular peculiar symptoms of the patient. So symptoms of heart attack include pain or discomfort in the center of chest, pain or discomfort in arms, left shoulder, elbows, jaws, or back. Everyone will not have everything. Everyone will have the center of pain in some particular part. In addition, the persons may experience difficulty in breathing or shortness of breath, nausea, vomiting, lightheadedness, and or faintness, cold sweat, and turning pale. Women are more likely than men to have shortness of breath. Stroke. Again, the most common symptom of stroke is sudden weakness of the face, arm, or leg, most often on one side of the body. Other symptoms include sudden onset of numbness of face, arm, legs, especially on one side of body, confusion, difficulty speaking, understanding speech, difficulty seeing with one or both eye, blurred vision, dizziness, loss of balance and coordination, that when I get up from the bed for some time, I need to balance. Or when I keep walking, I feel like falling on the other side, severe headache with no known cause, or fainting or unconsciousness. You will get to listen from a lot of people that 2 or 3 times it happened. They in the middle of the night they woke up to pass some urine and they fainted or got unconsciousness, and then they got all their tests done and nothing was diagnosed. They could not discover any abnormality. So might be they had some congestion in some region, some obstruction of blood flow, which caused that fainting in them. People experiencing these symptoms should seek medical care immediately. Rheumatic heart disease is caused by damage to heart walls due to bacteria. Rheumatic fever mostly affects the children in developing country. Symptoms are shortness of breath, fatigue, irregular heartbeats, high pain, high chest pain, and high fever 104, 103, and not coming down, with severe pain and redness of the body. One more very important problem, aneurysm. What is aneurysm? You will see sometimes in the wrist of some people, you will see ballooning of the artery, ladies or some, people who do a lot of muscular work or wash clothes. So they have muscles here. So you will see their arteries ballooned in a very little area. Ballooned and weakened area in an artery treatable by medical profession requires a medical diagnosis. Aneurysm often occurs in aorta, big vessels like an artery supplying the brain, back of knee, intestine, or spleen. So when it starts occurring, the patient feels heaviness in the body. Like if he thinks that if he is whatever pressure is putting in walking, he should be covering some distance in 5 minutes, but he is taking 7 minutes to cover it. Heaviness in the body, could not exert themselves. They could not. They feel heaviness in the body or leg or shoulders, and many times they will find hypertension. You will find hypertension in them, and that too very much high blood pressure without any cause. Echos are normal, ECGs are normal, and then if you find this thing, redness in eyes and high BP, you can think that you can get their body checkup for an aneurysm. A ruptured aneurysm can result a ruptured aneurysm can result in a very fatal condition. Aneurysm often have no symptoms until they rupture. I will tell you, there was a man who used to visit me in the OPD. He used to have normally BP 190 by 100 or what, sometimes 210 by 100 with red eyes and no other symptom. So we used to give medicines also, constitutional medicine to him, but he was going. And one day, we got to know that he fainted, he collapsed in his house, and a lot of blood was, he vomited lot of blood. Also, he passed lot of blood through rectum. And then later on, when he went to the hospital, I got to know that the diagnosis was abdominal aneurysm. There I learned about this silent killer, because I could not that time I was just 5 years in the profession. I could not think of this kind of diagnosis, but it was a great learning. Key facts: an aortic aneurysm is a bulge or weakness in your aorta, one of the main blood vessels in your body. Aortic aneurysm can happen in your tummy, abdominal aortic aneurysm, or in your chest, thoracic aortic aneurysm. The main treatment for small abdominal aortic aneurysm that are not causing symptoms is regular monitoring with ultrasound or CT scan. Surgery may be recommended for large abdominal aortic aneurysm. This is because they are more likely to burst. Now here, what a homeopath will do. Constitutional medicine will work in such cases, and also the sensation of the patient. What kind of, sometimes maybe patient is having the sensation, but when you don't have the knowledge of disease, you cannot ask the right questions. You cannot choose the right set of remedies to be confirmed with the patient. So knowledge of the disease is very important to be able to prescribe in the best way. So ruptured abdominal aortic aneurysm are a medical emergency and need immediate treatment with surgery. Now, treatment and remedies of all cardiovascular disease. So whenever somebody suffers hypertension or some other swelling in the leg, people will tell, look, doctor, look at my leg. The whole leg is swelled. Just my uric acid is increased, rest everything is fine. I am not suffering any heart disease. My echo is fine. See, my ECG is also fine. But just I am suffering hypertension. Look at the swelling in my leg. And it occurred when I fell on the road. No, there was no problem, but there was a big bruise, for which I took medicines also. And then I got some through some pehel once, through some some desi massages also on that area, but the swelling isn't going. There's a lot of swelling in my whole leg. So there you can think that a disease of arteries or the circulatory system has affected this person. So what a allopathic doctor does, whenever somebody approaches an allopathic doctor with hypertension and cardiac disease, they give them beta blockers. What does beta blocker do? They decrease your heart's workload. These medicines are used to relieve chest pain and discomfort and to help prevent repeated heart attacks. A lot of ladies who suffer fibroids in uterus, recurrent fibroids in uterus, they also suffer heart disease. Lot of ladies suffering DVT, they don't know even they're suffering DVT, and varicose veins, they also suffer from anginas, multiple anginas, but they are unable to express it. They will go for shopping carrying big bags and coming back with dyspnea and shortness of breath, but they are so brave ladies that their focus is to get the work done. They never complain, and they rest for a while, or they are in a habit of taking some painkiller. They rest at the night and the morning they are fine. Then someday somebody, oh, mummy was all right, and suddenly one day after having the dinner, she passed. Then they get to know what is the problem. Similarly, people suffering from diabetes, they are suffering from, due to diabetes, they start suffering with kidney diseases also, CKDs, and from there they start suffering the circulatory diseases and hypertension, and they also get this heart attacks. So beta blockers generally given to the people who have a lot of discomfort in breathing, have irregular heartbeats, they are suffering from thyroid also. Beta blockers suit them perfectly. All the medicine which end in all are the beta blockers: atenolol, metoprolol, propranolol. These are the beta blockers. And also they give ACE inhibitors, which work as the, tonic for the heart muscle. They help to lower the blood pressure and reduce strain on your heart. They also help slow down further weakening of heart muscle. Look, if you want to treat your people, you want to build up confidence, you need to know what allopathic doctors are giving. You should be very confident with those medicines, because some of our medicines are having the similar effect what they are giving. You cannot continue both the things together. Anticoagulants or blood thinners prevent blood clots from forming in your arteries. These medicines also keep existing clots from getting larger. Anti-clotting medicines. Anti-clotting medicines stop platelets from clumping together and forming unwanted blood clots. Examples of anti-clotting medicine includes aspirin and clopidogrel, and calcium channel blockers. They slow the heart rate and cause arteries to dilate. Calcium channel blockers include this medicine, Procardia, nifedipine. Any pine in the end is that remedy. Now coming to the homeopathic medicines, a wonderful medicine, Latrodectus mactans. We will go for the indications. You know, when somebody is having an attack, might be you cannot see, you can only go for aconite or some other medicine if you know the patient personally, or you know him, that what he's presenting with. Otherwise it is very difficult to people with such conditions are not going to come to your clinic. But still, you, if you know it, then you can see it. If mind knows, eyes can see it. So we need to prepare, we need to learn it, because it's a very good medicine. It has a violent precordial pain extending to axilla, and you will, lot of ladies will tell you, doctor, I don't know, when I go to my school, I hang my bag on this side, I feel like there's a pain in this side, this side. So you will check for the lymph nodes. It's not related to the breast. No, no, it is cervical and it is coming inside the axilla. You can use Latrodectus mactans to those patients, and it will give you great results. Lot of ladies, menopausal ladies, will tell you, when I wake up in the morning, entire my arm is numb. I have to clap or do something so that they wake up. So these numbness of extremities, arm, forearms, extending to axilla, the left arm feels paralyzed. This drug has all the symptoms of angina. Laurocerasus is useful when the patient puts a hand on the heart region, which relieves the pain. Cardiac asthma is relieved by lying down. Means if the patient suffering with the pain, so then his position must be with the hand pressing the center of the chest, because it is giving him the relief. And the patient feels better by lying down. Lilium tick has a cold feeling about heart. There is angina pectoris with pain in right arm. So it has a very good peculiarity. If somebody complains of pain in the heart going to the right arm and he feels it, he tells you, doctor, I feel like there's a problem with my heart. Lilium tick will be suiting the ladies who are just like sepia, and they cry like pulsatilla, and they have a lot of complaints with the uterus dragging down, feeling in the pelvis. If the uterus is operated, they will have obstruction of the portal circulation. So they will suffer piles, they will have varicose veins, and they cry like pulsatilla, and they have all the physical complaints of sepia, and they suffer right-sided angina. This is Lilium tick. Arsenic. Everyone can see these patients, because a lot of people who smoke, when they suffer from this angina, you can easily recognize such people through their restlessness, breathing difficulty, sudden tightness above the heart, agonizing precordial pain, which is extending the neck and occiput. This way the pain is going this way at the nape of the neck and the occiput. First remedy, if you see restlessness in the patient is arsenic, he'll show himself to you. Breathing difficulty, fainting spells, least motion makes him loose, sits bent forward, head thrown back. It is suited to tobacco eaters with organic heart disease. Apis. Apis, you will see, I have given it to lot many people, ladies, who were suffering, who completed with their cancer treatments, and later after post surgery of their breast, when they were having nodes in their lungs, and they received lot of radiation in their chest. So sometimes they suffer cardiomegaly, or swelling outside the heart, or collection of water in the outer covering of the heart. Apis is the medicine which helps them. They suffer tachycardia and burning and stinging pains in the center of the chest, and there is a dropsy, and Apis helps these ladies a lot. Pulsatilla again, pulsatilla is a very good remedy for the people who suffer angina after eating heavy and rich food. To ladies or gents who will say that I get to suffer breathing difficulties whenever I eat oily food, puri, or I eat outside, then I suffer this all these problems. Then you can find, if you can easily identify a pulsatilla lady. Uh, she will sit bent forward and explain everything, and she will have all the characteristics of pulsatilla. But if you want to identify that pulsatilla people in men, they are very loving people in the family. If he's a grandfather, he loves all his grandchildren and takes care of them. He's very sensitive for the son or daughter. Or when there is some problem in the family, some heart strain this person suffers and he has allergy to the rich and oily food, just shake a hand with that person. He will have, if he's a pulsatilla like person, he will have soft, very soft hands, as if you have shaken hands with some female. Try this. If sometimes you find such a patient, try shake hands. Let's see you find the pulsatilla man also. Phosphorus, precordial anguish from emotion, heaviness in chest, bar if weight lying on it. Phosphorus patient who needs phosphorus will tell you, doctor, there's so much heaviness as if some iron bar is lying on my chest. It's not letting me breathe or breathe or move forward. I cannot, I'm just lying here, I cannot move. Something is there on my chest. And also the same pain is there at the back of back in between the shoulders. At one point, I feel pain. So when somebody explains his symptoms like this, phosphorus is a very good medicine. And plus, if very nice, if the acute phase passes and you get to investigate the patient or take the case and you get to know the further mentals or and generals of phosphorus, your medicine becomes stronger. Try to give it in this LM potency. You will get better results. Spongia. Spongia is another very good remedy for heart. It, very often people, people, or I would say about myself, I have confused it with lachesis. Whenever I used to find an anxious person who used to tell me, I wake up with dyspnea. Whenever I sleep, I have to just wake up with dyspnea and suffocation. I used to give lachesis. Then in few people, when lachesis was not working and they were thyroid patients as well, then after studying it more carefully, I got to know spongia was the remedy which was helping those people, because it has constricting pain with anxiety, attacks of operation and cardiac pain, aggravation lying with head low, anxious, suddenly awakened after midnight with suffocation, alarm, and anxiety, and they might suffer with exothermic goiter. Lachesis, cramp-like pain in precordial region. How it happens? One day, a lady came to me. She had severe pain in the left side of the chest and a lot of numbness in the left arm. And what happened? How it started? Her husband went abroad on through this office, and she called up on his mobile, and some lady picked up the phone. There was some problem in the connection or whatever, and some lady picked up the phone, and she asked, who are you? Then she asked, who are you? Then suddenly she felt like as if her husband is cheating on her, and she developed this kind of pain in the precordial region, and which she was unable to lie down because the pain was increasing. Lachesis helped her a lot. People who definitely, people who have this lot of high D dimers and suspicious nature, and history of taking lot of alcohol, like arsenic is given to the people who take a lot of tobacco. Lachesis is given to the people suffering from heart disease due to use of alcohol, craving for alcohol. Lachesis is the good medicine. Lachesis is one of the most useful remedies in the heart affections, acute or chronic. The peculiar suffocation, cough, and aggravation from constriction being the guiding symptom. Next comes the sepia. People say only the males suffer from the heart disease, but most of the females who suffer with heart disease, mostly you will find they are sepia. Violent pain and beating of arteries in bed, relieved by walking long distance or walking very fast. Lot of women who have who have given birth to young children, at the gap of 1 year, two, three children they have born. They suffer from all these things. They feel better by walking. They say, doctor, I have so much problem that I cannot even rest. When I lie down in bed, the whole body, throbs like this. Then I think there is no use of lying down in the afternoon. I cannot sleep in the afternoon. Then I get up and then I wash the entire house. Then I do lot of household chores and I feel better. So this is sepia, and she feels angina a lot many times, and she's very indifferent. She tries to manage it on her own. You will talk to the patient, and she will be suffering heart disease. Plus, she will be having varicose veins. She will be having swelling around the ankles. So whenever you see swelling in the around the ankles or varicose veins, these are the candidates who can have heart disease in the future, or fibroids, or dragging down of the abdominal viscera down. These patients, because their circulation will get hampered, their venous circulation, their portal circulation will get hampered, and they might suffer piles. And if you read lot of literature by Clark and many other homeopathic authors, they have told that they have experienced that many times people who were suffering lot of glandular or constitutional diseases, when their glands were removed, or like if somebody was suffering from piles, and piles were removed, they had surgery for piles, they suffered heart diseases. This is what they got to know after a lot of autopsies and following up the patients. In India, following up a patient is a very difficult job because, everybody is not going to the government hospital. They don't have only that spot to go. They have number of doctors. For three things, they go to this doctor. To four things, they go to another doctor. But abroad, uh, they have this, this benefit over us, like because everybody goes to the national health services because they're free to them, so they are able to follow for over the years how the patient is doing after some treatment. Digitalis, you cannot forget this. This is a very important medicine, and lot of people has been using this medicine since ages. And the indications are sensation as to the heart stood still with great anxiety, must take a long breath, sensation that heart will stop beating if she moved. This similar thing is happened with the gelsemium also. Respiration is difficult, sighing stops when she drops off to sleep. When your symptoms include blue skin, numbness, and weakness of left arm with great fear, you can give digitalis. And Calmia latifolia is one of my favorite medicine, which I have given to lot of people who used to come for joint pains, and they used to tell that their rheumatic pains are like they start from above downwards, because we learned in a very nicely from our college days, below upwards Leadenpal, above downwards Calmia latifolia. And all these people, if you get to know, they are suffering from the disease of heart only. I have given Calmia latifolia to a person who told me that I feel like there is constriction here in my shoulders, and this pain goes down, and as if it is throbbing, as if eggs are boiling on these in these areas. So when I for these wandering rheumatic pains starting from the region of heart going downwards from the arms, and then legs and the body, when I gave this medicine, the patient was benefited with Calmia latifolia. And when rheumatism has been externally treated, the cardiac symptoms is ensue. So आपको अगर कोई बोले, if somebody tells you, doctor, if you are taking a series, proper case taking, yeah, what all diseases you suffered, if somebody gives you this history, then Calmia latifolia is your hero, and it is going to help your case in a very good way. Aconite, how can you forget it? Aconite for any sudden attack of pain, severity, heart, and dyspnea. Patient is anxious, restless with fear of death. You can see the picture of death over the face of the patient. Sudden acute condition from chill, shock, and fright. You will get to know, you would have read a lot of literature. They will tell you that somebody went out in the winter season and they suffered the chill wave and they came back, and then they started having all this attack, severe pain in the heart, restlessness, and aconite affected that person. And if they were not treated, they died of the heart attack. Similarly, Bryonia alba is the medicine given to the people when a lot of housemaids, when they used to go out of the house in sun, when they used to wash lot of dishes, doing a lot of physical exertion cardiac work in sun, when they from there they started having headache. This headache converts into high fever with chest pain. If not treated in time, they used to die with heart attack, or they used to suffer heart attacks. So bryonia is the right medicine which can help those people who started suffering pains in head or whatever after working hard in the sun. Some people will tell you, we went to the swimming pool or we went to the beach. From there, when we came back, we started to have all these pains and headaches and everything. So then you can, try bryonia with them and it will help them. Arnica, pain is squeezing in type or had got a shock. People who have lot of clots in the blood or uh, clots in the blood, and this is a typical hero of our medicines which can treat the angina. Pain is squeezing in type or had got a shock or blow. Ailments from strain and exertion on both mental or physical plane. Bruises easily, sore, beaten feeling, fears approach, pain especially in left of elbow. Lot of people will tell you, if you sit in a cardiac OPD, it also, like arsenic is very common, arnica is also very common. And labors will tell you, maids will tell you, people who work in the places where houses are constructed, they sometimes suffer this. So they have severe pain. After fever, they will have severe pain in the chest going to left of the elbow. You can treat these people. And the typical symptom of arnica is, if the patient is arnica and you want to confirm arnica, central to periphery, you have to check. There is coldness central to periphery. Peripheral areas are more cold to touch. If you will tell patient to show your hands and then you start touching like this, and you will see that as you go towards the periphery, the hands start feels more cold. If you go touch the forehead and then the nose is colder than the forehead. This is the typical confirming symptom of arnica. Spigelia is also a very good remedy. It has worked really nice with the people suffering from valvular dysfunction also. When I was working with the cardiologist, Dr. K.K. Agarwal, a lot of people used to come to him who were diagnosed with the hardening of the valve or failed valve, and they used to ask him, sir, why don't you change our this valve? He used to tell, your own valve is better than the new valve till the time it is helping you. So then there we prescribed Spigelia to lot of people having left-sided problem, violent beating of heart so frequently that could hear the pulsations, pains, aggravation sitting down, bending forward, slightest motion, amelioration lying on right side with head high. Kali carb is also indicated. Strictures through the heart and through the scapula. Aage se from front to backward. Patient asks for rubbing his chest and back. Violent burping give a great effect. Kali carb also covers this. Carbo-veg also covers this. Patient leans forward on arms to take weight off the chest. Spigelia will help. You will see a lot of women who suffer with the varicose veins or portal congestions or piles or fibroids or cramps during periods. Sometimes they suffer severe catamenial headache during that time and left-sided headache. Spigelia helps in a wonderful way. If these ladies will keep on taking painkillers, one day they will suffer heart disease or circulatory system disease. But spigelia will help them like a magical remedy. Last but not the least, cactus, the sensation of constriction in heart as if an iron band is preventing its normal movement. Small irregular heartbeats with the need of deep inspiration. Constriction and clutching sensation in head, chest, diaphragm, and uterus. This medicine, just the sensation if the patient says, this, it is not letting me move, I can't. You can always on the first number, you can think of cactus. If you have cactus 6, it works wonders. Because I had a patient, she started to menstruate very late after 17 years of age. Before that, she was taking treatment from me. Just before the arrival of her first menstruation, she suffered severe pain in the back, lower back, as if somebody has tied a big iron uh, big iron lock on her back. I gave her Calicar. And then one day she told me she came with a severe pain in the abdomen as if somebody has clutched her from there and she can't move. I gave her cactus, and the same night she started to menstruate. So these are our medicines which work every way whenever the indications are given. I don't think so. Anywhere you can find so many remedies for the patients. So for everyone, so many remedies. But for that, what this is our fate that a homeopath has to read. Homeopath, if he earns bread, he has to work hard. He has to talk to every patient. He has to take out the peculiar symptoms. He should have the knowledge of the remedies and knowledge of the disease. Then he can work wonders. He cannot have that pleasure of sitting with 5 remedies like allopaths sit, and to every patient they will write it and let's see what happens. So we have lot to do, but we have to always work hard with it. So at the last, I would like to tell you, amyl nitrosum is like a sorbitrate. Give it an inhalation. When somebody passes, somebody's not responding, suddenly some elderly patient with blue tongue, try giving this amyl nitrosum to that patient. It might help, and then rush to the hospital. Cactus act as a beta blocker, calcium channel blocker, and also work as sorbitrate. It has all the 3 properties. Lot of people who used to tell me, when I walk, I feel like there are iron wires which keep on getting tighter and tighter, and I have to stop. I have to call somebody from my house to take me. Cactus will relieve those patients as if they never suffered. Viscum album and lycopus are our beta blockers to the patient who have severe dyspnea and cough problems while walking, along with the hypertension. And cratagus, it has got the anti-proteinuric effects when the target organ is damaged. It is our ACE inhibitor. And how will you get to know that the kidney is damaged? Some patient comes to you with hypertension, get the urine microalbumin done. If the microalbumin is raised, then this means the kidney has started to get damaged, and you can do this test often with this diabetic patients, and you can use Cratagus with your diabetic patients who have a hypertensive. Sometimes only single remedy, single medicine you apply, which covers everything, helps your patient in a wonderful way. So this was a small effort from my side to share what I know a little bit. Anyone wants to add something?
Yes, Dr. Mini Mehta, it's really an excellent session, a wonderful session, and really a worthwhile session. Those who attended the session really enjoy the beauty of homeopathy, and you really mentioned the differentiation between each and every remedy. And not only simply saying these are the symptoms of this particular remedy, but instead you mentioned some of your cases. That is the beauty of your presentation. And as all of us know that nowadays a lot of people are suffering from the cardiac patients are increasing day by day, and we as homeopaths have a very good opportunity to treat all these patients. If you are able to treat one patient with the cardiac problem, definitely more and more people will come to you for homeopathic treatment. We know some of the brilliant doctors are practicing even in cardiology alone. They are having there are doctors who are able to avoid this kind of uh, surgeries by giving our homeopathic remedies. Even 15 to 20,000 cases were treated by some of the doctors in or one of the doctor alone. We have a recent report in our paper. Anyway, all those things you mentioned are really worthwhile to those who really watch the session, and these kind of presentations are really bring the best for homeopathic professionals also. Whether you be a beginner or a practitioner who are having a lot of practices, but still this kind of presentation definitely is a very good session for memorizing all those remedies in a short way. You begin with the that particular medicine, and then you covered all the. Nobody could think that you lack this Lilium tigrinum has such an action. When the patient is having pain on the right side, and it begin on the cardiac region, and she is just like pulsate, like, as you mentioned. All those things are really will memorize. Everyone will memorize all those things from your presentations. You really presented it in style also. That's you. All those things come out from your heart itself. That's what we felt about the presentation. Anyway, congratulations, and those who want to participate and want to ask questions and to have a chat with Dr. Mini Mehta can come out, and here Dr. Mas from Malaysia is there waiting for chat. Yes, Dr. Mas, you can come out.
Yeah, thank you so much, Dr. Mini, for the very interesting presentation. I would like to ask this question regarding your potencies and also the frequency of the medication that you give. How long is it for?
I'll tell you, if somebody comes with an acute pain, like I told you, that somebody comes to me and says, Doctor, look, I have entered your chamber and I'm feeling like something tight in my chest. I will tell him, take Cactus 6 one dose now. Okay. And then I will give plain alcohol, plain SL to that person, and I'll tell them to report after 3 days how much that person is feeling. Lot many times they are better for a week. So tell them to visit you every week along with the constitutional medicine. All these medicines like Cactus, Digitalis, when you get a symptom, right indication, a single dose helps a lot, and it keeps on working. It has and you will get to know the span. And also when if I say that somebody comes to my clinic and he is under the heart attack, then I will dissolve aconite into the water, and I'll keep on giving 1 teaspoon every 5 minutes, every 10 minutes, till the time the patient gets better and sits on his own. We decide the potency. If the heart muscle is damaged, you get lot of pathology, then 6 potency. When you get more symptoms more on the level of the sensation level, like patient will tell you the mental plane, symptoms on the mental plane, you can choose the high potency. Or you could see the patient is in acute condition, like you could see that he is going down, like he's falling, you can use aconite 10 m, 1 m. This is how you use. It is a very elaborated subject, potency. And I have not mentioned one remedy, Aurum metallicum. It is a wonderful medicine. I'm sorry, I just forgot because there's so many beautiful remedies. Aurum metallicum is a wonderful remedy. What, patient will tell you, doctor, I have come to you for constipation. I have a problem. I am unable to pass motion. If I've not passed my motion, I'm upset throughout. What do you feel? Then my heart is not working properly. I have palpitations. What happens to your heart? Sometimes I feel like it pounds like this and then stops. It comes up and goes down. Aurum metallicum 6, one dose I gave him, then followed by the SL or the previous medicine I was giving, what he was taking for something, in every meeting, the patient discloses some more important information. That patient told me this thing he was suffering from a long time and now he feels completely all right. Now he wants me to give him medicine to continue the effect of that medicine. When the symptoms are acute, you can repeat it at every 5 minutes. When it is, in a chronic disease, you get the best of the indication. A single dose will start, dismissing the total pathology.
Thank you.
This is
Thank
Okay,
you,
how
Doctor.
it works.
okay, now I invite Dr. Boglim to have a chat.
Chat.
Congratulations, Dr. MEHTA. You had
Thank you.
excellent job into this presentation. And I think has benefited many people. Especially your topic today is very, very interesting regarding the heart ailments. And there are many what we call that remedies that you have presented is very good. And can you just explain something about spigelia? Because I use spigelia once, it can help to relieve the blood pressure, the high blood tension, and the patient just got well, no hypertension.
Spigelia patient will always tell you problems with the headache on the left side of the head. Covering the eye, extending to the eye. I have pain coming here, it is at the back of the eye. And then you will confirm all other symptoms, general symptoms with these indications. Spigelia will abort all these problems. And and you will read lot of literature. Spigelia is such an important remedy in treating the cardiovascular disorders, whether it is the narrowing of the arteries or whether it is the, some problem in the valves. Spigelia is a wonderful medicine. I will tell you, I was treating a cancer patient. He was having a big lymph node on the left side. Like he was responding very well with bromium, right? But he was having severe pain. Whenever he used to feel better, blood supply has to come to that area for healing the ulcer. That time he used to feel the pain, and it was typically the pain indication of spigelia. I just dropped a dose, diluted dose of spigelia on his tongue, and he was like this. He was in severe pain, and he was like this. And he said this. He was there for 10 minutes, and he was like this. He was enjoying that nullification of pain. I don't know. I could see how this dose helped him in his circulation, the tense feeling he had on the left side of the area. This much effect, because we treat with the similar medicines. We treat which have a similar effect. So it had a great effect on the left-sided circulation. He was, giving the gestures as if he's in heaven. Morphine could not give that reflection. What spigelia gave to that person.
Excellent. Good sharing.
Now it is up to Dr. Ram Pareshat. Please unmute. Please once again unmute. You're mute yourself. Please mute. Please unmute. Yes.
Thank you, Dr. Dhaneji. Congratulations, Dr. MEHTA. MEHTA is a dynamic person and dynamic lectures. Nice presentation, excellent session. Beautiful describe many kinds of medicine, sign and symptom, cardiovascular disease. Very thanks, MEHTA, IFPH. पूरी टीम जो है, you are very obliged. Thank you. Very, very thanks.
I'm thankful to you, Mira. I get to revise every time when I speak. It is every time, you know, when I revise all these things, next day somebody will come who required the rarest medicine, which I revised for
Okay.
you all.
Okay,
So
now
it
I
always
invite,
benefits me.
okay, now I invite Dr. Neha Kakar to say vote of thanks to this session also.
Yeah, a very brilliant session by Dr. MEHTA. As we know, she's treating at Rajiv Gandhi Cancer Institute in Delhi, and she's also collaborating with Dr. Farooq Master in Bombay and treating cancer patients. And I hope this session with her, where she elaborated about different medicines on heart problems, would further help us to have her experience and we imbibe that into our practice. So it was a wonderful full session from Dr. Mini Mehta, and I hope we'll obviously have her many more sessions from her. Thank you, Dr. Mini, and on the behalf of IFPH, I thank you very much. Hope to see you again, ma'am.
Good
Thank you,
night.
Dr. Thank you, Dr. Neha Kakar. Tomorrow we will have a session from Dr. Bipul Panda, and so we'll be presenting application of organon of medicine in daily practice to treat and our preparedness to deal with it. So that will be the session tomorrow. We are very, very thank you to Dr. Mini Mehta, as well as those who participated in the session. With that, we come to the end of the day, 1348. It is over to Dr. Mariamma John to moderate our Malayalam session. Thank you all. Good night.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1348 പ്രതിദിന സൂം വെബിനാറിലേക്ക് എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മുടെ ക്ലാസ്